Hello, everyone. I'm Dr. Renee Mehrra, and welcome to our show on TV Asia and on social media. We continue to talk about this invisible enemy, the global pandemic COVID-19, that has completely wrecked our lives, consumed our lives, and it's actually given us a new perception and a paradigm and a new mindset that sharing and giving and being more sensitive to the needs of others has taken on the new normal with washing our hands, sanitizing groceries, and wearing our masks and observing social distancing. And we have today, first, COVID-19 experts from Mount Sinai Hospital. And I want to first thank you all for risking your lives, being on the front lines as healthcare workers and even our essential workers. They are really our true warriors in this fight against this invisible enemy of COVID-19, a small virus that can only be seen under a microscope and has created havoc all across the world. So telling us more about the update on this and what happens if you are critically ill as a COVID-19 patient or you have a stroke or a heart attack, how do we maintain our poise and equilibrium through yoga, meditation, deep breathing, all this and a lot more with our experts from Mount Sinai. So joining us is Dr. Sharma. He's a professor of medicine at the Icahn School of Medicine, Senior Vice President of Operations and Quality, Mount Sinai Heart. Thank you, Dr. Sharma, for joining us. Dr. Annapoorna Kini, Professor of Medicine at the Icahn School of Medicine, and she's also the Director of Cardiac Catheterization Laboratory, Mount Sinai Hospital. Thank you, Dr. Kini, for being here with us. And Dr. Umesh Gidwani, Associate Professor of Critical Care at Icahn School of Medicine and Director of Cardiac ICU at Mount Sinai Hospital. Thank you all. And let's go first to Dr. Sharma. Give us an overview on the COVID-19 situation. I know in New York, it is really bad, especially Queens County. Also, we know now that research states that this virus has different strains and duplications and mutations. And what happens with these strains? Does it become more virulent? Does it become less virulent? Do people get antibodies for the next strain, or if they're tested positive for one strain, do they have a lesser of a symptoms and lesser of an illness? What happens? Is it getting more deadly? So you have to share with our viewers the latest, and we're going into the advanced level of COVID-19 with the latest research that comes from your hospital. Thank you, Dr. Sharma. Go with it.
Yes. Yeah, Dr. Renee Mehrra, thank you very much. And of course, TV Asia, to give this great opportunity to give our views from Mount Sinai faculty. And we'll keep knowing that you have done quite a bit sessions on this topic. We'll try to be more precise and more advanced in terms of what we will be discussing. Everyone knows this COVID virus started from China end of 2019, and it's a family of coronavirus. So this has become very virulent. So nobody expected that we will be in this, I call it simple mess. Although the history repeats for last 400 years. 1720, 1820, 1920, and 2020, starting with the plague, the cholera, the Spanish flu, and now with the COVID. So these pandemics will happen. But one of the biggest thing about this coronavirus is, of course, Dr. Kini will talk a little more about how it multiplies and so. But important problem is, which we are having trouble. 4 months passed by, scientists are still not able to get a control. Besides what you mentioned, the usual containment measures that you do a self-protection, social distancing, and the clean your personal hygiene improvement. Is it because this also virus showing a lot of mutation? They apparently 30 times have mutated, but there are 3 varieties, what called A, B, and C are the most common. A started in the original with the Wuhan, but then it became B very quickly and then became C. So B is usually now is in the Europe, and C probably has affected other part like United States and partly in India also. So it's a combination of B and C, and some places is A also. What is the importance of this? What happened is this virus has a special protein, spikes, S protein we call, and that changes this amino acid sequence and become mutant. So therefore, we are, as you mentioned, it's the invisible enemy which is changing clothes very rapidly. And that will become very important factor when you try to target it either by medication or you want to make a vaccine. Because how, if the mutation occurs, how can you make a vaccine will be a much difficult task. Same way, various medications will be very difficult. So therefore, we are amidst of a global pandemic. We are in big trouble at present, although it seems to be that just like what was seen in China, the peak occurred and then died down because of various containment measures. And this is where looks like that New York is now. Like India is still going up, but New York or United States have seen little downfall. I can tell you in our own hospital, the number of cases, number of ICU admissions definitely have decreased. Patients are going home, are being discharged. So seems to be that various measures which are seem simple but working, and maybe a little control on the spread of the virus. We are not saying that we have won this battle, but at least making some baby steps towards controlling this virus. The biggest issue with the virus will occur is that it's a mutant. It changes its of course replication, but key is the strain changes and mutate quite commonly, and it will be a big challenge for us.
Right. So, which means that every time it's mutating or duplicating, it may not be the same. As you said, it changes its loads. It disguises itself pretty well. But the good news is that we've hit the apex, and I think the worst is over, hopefully, in New York and parts of US. Dr. Kini, tell us how this virus multiplies and transmits, and share with us on this, and then talk about other treatments that you're talking about, in terms of holistic way of looking at things.
I'm just going to start with this slide, which I'm sharing right now with you. This is what I think the coronavirus has been shown all over, which is the spike protein, which Dr. Sharma was just mentioning. And it's the other name for this virus is also called as SARS-2, COVID-2. So why this, you see that the spike protein then gets attached to what is called as an ACE2 receptor. Why this is very important for us to know that this receptor is seen mostly in the lungs. That is why majority of the people are getting problems with the lungs. It is some of it is also in the intestine. Some of the ACE receptor are on the heart muscles and on the kidneys also. That is why we see that this virus, once it enters the body, it attaches to this receptor like you shown here. Then the membrane is broken, the gene particle comes out, it's an RNA particle, it replicates, then further forms another virus, and then it goes out. So how this is then transmitted from people to people, same, since it's mostly in the lungs, the common way is just by either sneezing, coughing, this virus comes out of that particular infected person. And then what happens is once that happens, it's either that you are very close to that person. That is why they said that you got to have social distancing. You got to be 6 feet away so that when the person is talking, coughing, sneezing, you're not getting that virus. For whatever reason, the virus comes out. It could also, droplets could be falling on certain surface. And this was the paper that came out from New England Journal, which said that if it falls on the surface, which is usually stainless steel plastic, it can be there almost up to 72 hours. But more important for us is cardboard, which is like a cloth, that even on the cloth, it can be stuck. So very important that if you're near somebody or you're exposed, that is immediately changed. Very important, I think, point that we need to also know about this virus, that this only has a plasma membrane here. This membrane gets destroyed when the temperature goes very high. So our only hope is right now, we are still, early spring, and when the summer comes, this virus probably will be killed in the hot temperature. And this is exactly what the slide shows. Just showing some important characteristics of this virus is what are the important symptoms which I went through is cough, fever, and it also says diarrhea, vomiting, but we have been seeing since some mutation that it has been affecting CNS, with the people saying that there is some change in their sensation of the smell.
So how do you know it's diarrhea and vomiting is not food poisoning and it's related to the virus?
Common symptom is fever. So usually you'll have fever and then some abdominal symptoms, or you'll have cough and then some abdominal symptoms. So it is, a couple of symptoms will be together. Other important thing, you probably more common than nausea, vomiting is the allergy and flu, which is also coming up right now. So if it's allergy, flu, you will normally have some sinus symptoms more important than just a fever. You don't see fever that often with allergy and flu.
Yeah, and then plus there's more itching during allergies. So that's again another symptom that comes in there.
Yeah, swollen and red eyes.
Exactly. And I'm going to talk about...
And actually other important thing is, which also have come up, is like loss of smell and the taste. So, and that is taken all together, as you write. Many of those abdominal symptoms, diarrhea, vomiting, first thing you will think about is the food poisoning. And that is where the whole issue comes. That even if you have a little cough and fever, everyone thinks, you know what, I got a little flu. I got some sore throat. That's where the biggest problem we have. Biggest problem is that people are carrying the virus, not knowing it. And secondly, before they get sick, they can transmit the disease to many, many patients. So this is where the real strong enemy which we are encountering. One, it can be done by the asymptomatic patients, asymptomatic people, no patient yet. So asymptomatic can transmit the virus, and before the disease comes, it may delay 1 or 3 days, but before that disease, pre-symptomatic conditions, days, 1 to 3 days, somebody can transmit the virus. And that's where the big challenge will come, that how to contain it, and somebody working with you, otherwise normal, not coughing or having fever, but yet can still be the carrier and distributing the virus. And that's where the liberal testing for the virus, antibody or antigen testing, will really make a big difference in future.
And this is for all the strains of the virus and duplication. You're talking about the diarrhea, vomiting, and the flu kind of symptoms. This is all for all the strains that's looking at this time?
Largely so, yes, all of them.
Dr. Kini, I'll come back to you on the non-medical strategies when I go to Dr. Gidwani. You are hands-on in the ICU, and tell us about those critically ill COVID patients and who need ventilators, and we're going to talk about the downside of ventilation as well. So tell us what we're looking at the ICU these days.
So Renee, thank you for having us on. Dr. Sharma, Dr. Kini have laid the good groundwork of what is happening as far as there are different strains and how they replicate and what are the antigens on the virus. I'll talk about this illness that is there. And the most important, one of the important things I want to point out to you is, I'm sure you learned readers know about, Gabriel Garcia Marquez, who won the Nobel Prize, and he wrote this amazing book on love in the time of cholera. And this really sounds exactly like that. And I'll take a quote from there. It says, the fires had been put out by the volunteers using ladders and buckets of water and methods so disorderly that they caused more damage than the fires. And I cannot, it is so reminiscent of what we are seeing here, because when we look at this disease, there's initially this virus phase. The virus enters the body, it multiplies, and you shed virus. And this is a very tricky virus, because when it's doing this, it is asymptomatic. So you're with your loved ones and you don't even know you have symptoms, or you have some mild symptoms. Like Dr. Sharma said, maybe a little bit of flu, a little bit of fever. We all get that in the winter time, in the springtime. And that's when the virus is silent and multiplying and shedding and spreading. But the time they come to me, there is this massive inflammatory response where this virus has set the fire. And now the body is putting out these fire extinguishers and these missiles directed against the virus. And these are non-specific missiles. And they put out not only the fire, the virus, but also the tissues, most importantly, the lungs, which are the portal of entry, the kidneys, the blood pressure, what we call circulatory shock, and a fourth system, the brain. So all of these patients have some kind of brain dysfunction or what we call encephalopathy, which is multifactorial, but the virus has a large part to play on it. And so obviously I see the worst of the worst, right, in the ICU. But not everyone sees that, right? In the virus phase, like I said, you can have symptoms or be asymptomatic. 70–80% of patients are asymptomatic. They spread the virus, people don't even know. Of those that are symptomatic, when they show up, you'll do a test, the doctor will, and send them home and say, we'll call you with the result. And they heal at home, they nurse at home, and some are sick enough to be in the hospital. Once they are admitted to the hospital, they can be sick enough to be cared for in the general medical surgical wards, or some of them are so sick that they end up in the ICU. And the patients in the ward may also, during the course of that illness, get so sick that they end up in the ICU. Once you're in the ICU, this is a whole different prognosis. A lot of people, when they enter the ICU, they're acutely ill, severely ill. And the question is, how should we deliver the oxygen? Because of course, the main problem is the low oxygen, what we call hypoxia. And now they've transitioned from what is now recognized as asymptomatic hypoxia, or in layman's term, they call happy hypoxia. In other words, patients are not too symptomatic, but they're still hypoxic. And now they've become so sick, they end up in the unit. And what should we do? Should we intubate them, or should we intubate, in other words, put them on a breathing machine and deliver oxygen? Or should we find other ways of delivering oxygen? And so typically we can do some non-invasive ways of giving oxygen, but the sick ones really no longer are corrected by just giving non-invasive oxygen. So they get intubated, which means they have a breathing tube, they go on a mechanical ventilation, which is a breathing machine. And once you're on that breathing machine, it's very difficult. Okay, some latest data suggests that 80% of patients who are on a breathing machine don't make it. And so we try extraordinary measures, things like proning, which is we make the patient sleep on their belly to readjust the fluids in the lungs so that you can improve the oxygenation. We use certain IV and inhaled medications, such as the prostacyclins and the nitric oxide, to try and improve the oxygenation. And some of the other extraordinary measures, which we are still finding that may or may not work so well, are something called extracorporeal or ECMO, where we take the blood out of the body and put it through an artificial lung and bring it to the body. But I will tell you, once you reach that level of severity, there is a very high mortality. In other words, very low chances of survival. Let's assume you survive, or you continue to do these things. There's only two outcomes. One is that over time, you do not make it, or if you do, then you go to rehab. And we are following some of these patients who are quite ill, and this illness has wreaked havoc with the body, with muscle wasting and metabolic dysfunction, and they require long periods of rehabilitation. So bottom line, we have a lot of treatments, and we are still playing with, we are still trying to find out, we're still trying to get some precision on what are the medications to use at what time. And I will tell you, so far, there is no proven medicine or intervention by randomized controlled trial. In other words, the gold standard. If we were to do this in so many people and not do this in so many people, who would do better? We still don't have a definitive answer. There are some promising answers, antiviral medications, or even maybe, trying to thin the blood, because blood thinning is one of the things. These people have very thick blood, and the question is, how do we, thin their blood so they don't get so many clots, they don't get so many strokes, they don't get so many heart attacks and lung embolism or lung attacks. So this is all, being studied right now. And I'm hopeful that in the next 4, 6, 8 weeks, there will be the early emergence of the gold standard randomized controlled trials.
I see. So that's good news that there is going to be a randomized trial very soon, because it's a very new virus and we're learning as we're moving along. It's a very grim picture in the ICU, and then even if somebody recovers, the downside of all those effects of the ventilator are pretty, very, very grim. Dr. Sharma, talk about some of the medical strategies that we're looking at, because again, it's a new virus, so we're learning as we're going along. The researchers are working on it with the randomized trials and everything, but what are some of the proven medical strategies at this point of time?
Yeah, no, the very important what Dr. Gidwani just said, and actually is the front story of the New York Times today, that in early stages, they cannot breathe. Their blood count, usually saturation should be 95%, it's 70, but they're still talking, not feeling it. So this lung is the very big issue. And I think more and more we get early and treat them with a high flow and avoid the intubation. As mentioned, intubation have mortality of 82%. And maybe our Prime Minister, UK Prime Minister, improved because avoided the intubation. Boris Johnson, that's commonly said. So key is that detect early, but this is again the disease which we are learning. Second issue about the clotting, and that was part of the CBS News last Friday, National News. They interviewed me about what is happening. So this is again something, because this disease is not described anywhere. We are learning as we are treating these patients. And one of the things is the clotting. They're clotting in the leg, in the lungs, in the heart, in the brain, in the kidneys. All those have their consequences of swelling of the legs, developing difficulty in breathing, having a heart attack, developing kidney failure, stroke, seizures. All those are very, very new understanding. So once we understand what the problem is, there is a bigger problem, and that is that in these patients, in terms of the treatment point of view, is that there is truly no treatment of this disease. So that is the biggest issue at present, that we have no treatment, consistent treatment of the disease. Yes, vaccine people talking about, very excited about, but this is far away. As we have spoken already, everyone there right now, apparently 19 companies, 4 of them from India. One of them, Serum Institute, which makes the highest number of vaccines for the worldwide. They actually declare with the Oxford relation, in conjunction with the Oxford, that they will come up with a vaccine very shortly. That's true, but we need to see whether it's potent and which strain it is, and then of course the mass use and mass production. So big issue will remain. But the key is there has been no consistent treatment, and some of them which already were alluded by Dr. Gidwani is the 2 issues. One, we need to take care of the effect of the virus, and secondly, directly affect the virus. Now, what is the effect of the virus? Because virus release various cytokines. So we have the cytokine inhibitor called IL-6, like toxridium, the steroids, they all inhibit the side effects, or you can say toxin of the virus. And those are many studies ongoing, some with a good result, some with not so good results, but we usually use them. And steroids have become the early stages, although again very controversial. The most important the issue remains through the virus which comes into the cell, mostly of course the lungs, that there are various inhibitors, and most common inhibitors actually are the RNA polymerase, because of course the virus is the RNA, and many drugs, the combination in various, as shown here with the cycles, have shown some initial benefit, but then other randomized trials show no benefit. And the classical example is hydroxychloroquine. Hydroxychloroquine initially touted as a great drug because some initial studies from Italy, from China, and we did that study in United States, we found more mortality, higher mortality. So FDA actually sent the alert today. that you should not be using hydroxychloroquine for the treatment. So I still think hydroxychloroquine probably has a good role as a prevention. People who are exposed like us, that taking 200 milligram per week or so as a preventive measure, but as a treatment measure, now we are not doing it routinely, which we were doing before. But just to emphasize that there are multiple treatments which are being studied at present, and all look promising, but yet we do not have a final combination or a strategy that is going to work. The two very the promising strategy, one is the convalescent plasma, that is people who already have infection. Infection is away, but their antibody can be injected. So we actually have done, Sinai is the leader in this. We have done on 250 plus patients. We don't have the results yet, but hopefully we'll know about it. Has already started in India also. And there was a news about 5 patients, the use of plasma, and 4 of them improved. But again, you need to see a large number of data and large number of patients where it is effective. The second one is the mesenchymal stem cell therapy. So that actually just came out from Mount Sinai, again on 15 patients. As mentioned, that once you are intubated, your mortality is 82%. Then they did in 15 patients after intubation, use the mesenchymal stem cell. And what it does, it prevents all those cytokines and the antidote kind of site for the cytokine, and let the virus, prevent the release of the cytokine mediated through the antiviral factors. So this mesenchymal stem cell therapy becomes very important. Having said that, the most important in this issue, as we have mentioned in our presentation, that many of these patients have a very atypical presentation. But at the same time, more important, like my field, cardiology, many of these cardiology patients may have a symptoms which may mimic the COVID-19 symptoms, but truly they are having a heart problem. And now they are worried about going to the heart hospital, and so they're waiting because they think that you go to the hospital, go to the emergency room, they're going to contract the virus and will create a problem. So biggest message, which I still say, that while the COVID-19, let's say in the same duration of time, have killed 12,392, but during the heart also just about a little more than number of what is killed by the COVID-19. So heart still remains a major issue. I know that number of heart patients have decreased. STEMI, which is the real heart attack, has decreased because of better lifestyle, exercise, low pollution, and so. But we want to emphasize in this that if you are having a heart problem, don't stay home. This is a nice pictorial which was sent to us by American College of Cardiology, sent to various the investigators, hospitals, and so. And basically, as a public education campaign, that if you are having trouble, you're having increased your heart symptoms, you will have a much more risk of staying home rather than going to the hospital with the potential for the contracting COVID-19. All the hospitals are very careful. The staffs have been tested. We have the COVID-19 units, and we have the COVID-free units. So clearly that these type of patients who do not have COVID, they are segregated. They are taken care different way, and clearly that emphasis is being done to protect the patients, protect the staff, and that is being done. But at the same time, my plea to our public, our patients is, if you got the heart problem, do not delay. And that was a part of a New York Times story on Saturday, that few patients who presented to Mount Sinai waited 40 plus hours at home with the heart attack because they're afraid to go to the hospital for contracting COVID-19.
That is a very critical issue here. If somebody's suffering from cardiac issues, heart problem, or thinking there's a stroke, somebody I do know had a minor stroke but was rushed to the hospital. So it is important. At one point, I know we feel that there's a community spread, but on the other hand, this is another very important issue for your health. If you have a heart problem, or something is going on with a pre-existing condition, it's important to go to the hospital and get treatment. I'm going to come back to you, Dr. Sharma, on the concluding part, but I want to go to Dr. Kini, and let's talk about the non-medical strategies, the holistic way of looking at things. I think we're going back to the ancient mystics and sages who talked about yoga and pranic breathing, and you know, to stay calm and really fight off a lot to boost immunity with a nutritious diet.
Yeah, so if you can start seeing my slides again. Essentially, I think what best way to treat COVID was to treat the symptoms, but the same thing is that the best scenario is that you avoid getting the virus. That is why it was said that you got to isolate yourself and stay at home. And that's also true that if you do not get the virus, then you're not going to have symptoms, or you will not be asymptomatic or transfer the virus to somebody else. So now you're home. The question is the same, that you're what they call as lockdown, that what can you do for yourself? Essentially the same, continue your routine. Don't change. If you're supposed to go to work, wake up in the morning, do your routine. And what we are promoting is that everybody should do some kind of exercise at home, though the gym are closed. So there are various exercises, and what really has shown is that doing some kind of a yoga at home, because you can do this anywhere. You don't need any kind of equipment. All you need is a mat, or even you don't have a mat, you can just do on a carpet that you have. What I'm showing is a morning flow, which is also called a Surya Namaskar. All this, you can do this various flow multiple times a day. Or what you can do is the same thing you can do few times in the morning. That will just increase your heart rate, and it is a good start. Now, how is there anything in yoga that we think would help during COVID? Is a kind of breathing which is called as Kapalbhati or pranayama breathing. And why this breathing pattern is important, I already explained. The virus gets through the receptor, and the receptor is mostly located in the lungs. So breathing part is very, very important. And if I can show you what is Kapalbhati breathing, if you see here, you're sitting down in a place and slow, normal inhalation through the mouth, and then you go as deep as you can. So what happens is you see expansion of your diaphragm as well as the chest wall. So your lungs are fully expanded. So your alveoli is also expanded in the area where normally you do not, it doesn't expand. Then you do a quick forceful exhalation. So what you can do this when you exhale, quick and forceful exhalation. So this thing you can do anywhere between 5 to 8 times, and do it few times a day. So this will not only help your diaphragm and abdominal muscle as well as the chest muscle. It is nicely explained here how you do this breathing. This breathing definitely will help you to get rid of the so-called COVID virus. And for many people who are, especially the first responders who are standing for long hours, we are doing now 12 to 14 hours long hour duty. A simple exercise when you go back home in the night is what is called as bridge pose, or called as Setu Badhasana. Here, essentially you're lifting your lower back up, that plus pelvis, that will relieve any kind of back pain, your extension of your hamstrings as well as your calf muscle. And here your chest is also extended. By doing this, it just relieves the whole stress that you have had or you've carried entire day. Also, what happens is social media is so active, it's only propagating negative things about COVID. There is also positive stuff. Many patients are also going home. So just by seeing this negativity everywhere in the social media, stress is contained inside people. So you can do any kind of exercise, or what you can do, what is called as meditation, also called as it's a guided transcendental meditation, which is a guided meditation, which is available on the media, on the YouTube, anywhere else you can go and do this meditation. Just 5 minutes, 10 minutes, that will actually help you get out of this stressful situation during this COVID-19.
That's right. And of course, gargling twice maybe with salt and turmeric can also help for the sore throat.
Very important.
Yeah. Dr. Sharma, you talked about plasma donors, you talked about the vaccine. I want to go back on this and then talk about the future of COVID-19 treatments. Plasma donor, will that benefit somebody who has a different strain of virus from the one that the plasma donor had? Number two, Can we have a universal vaccine for all the strains and the duplications and the mutations? And you also talked about hydroxychloroquine, which is now more of a preventative measure rather than while the person is having a full-blown, illness at that time. Again, which are the ones that are going to be FDA approved? Maybe in a few months we might have some more treatments. So give us something. I hope it's a better positive picture.
Yeah, no, that is true. So I think what we learn is the antiviral therapy may not be the answer. So because few trials negative, positive, or other chemical treatment, just like hydroxychloroquine. No. So what could be plasma therapy? Now, plasma is the site specific in the sense that what has been shown that of the 3 strains, A, B, and C, so one strain is the one which is most common in one particular country. So that is where the issue comes down, that you basically, if I just show that what has happened, the A or B or C, so outbreak, whether A started with the Wuhan, then went to in America and Australia, B in China, and actually the C in Europe. So key is that for that area, let's say New York, it's likely is A. So therefore, the plasma which is obtained, it will be good for our locality. So that convalescent plasma will have antibody for A strain of the coronavirus. So that will be good. But you're right. What if the second mutation occurs? But we think, and that is what studies have shown, that once you have subclinical infection in the public, 65–70% are infected, which we call herd immunity. That will be the answer. So then every time you have little strain comes, they will come up with a new vaccine, and that will not be affected the way we have been affected now. So very important positive note will be twofold. One, that the summer is coming. As Dr. Kini mentioned, that hot temperature, the virus doesn't live only for a few minutes or so. So hot temperature will be our savior. Secondly, more and more people getting subclinical infection and developing immunity. So herd immunity will be the answer. And that is what they say, that countries where they have a BCG vaccine called innate immunity, it's kind of same modification of the same, that your body makes the antibodies without showing the infection. So countries which have BCG vaccine has a 5 times lower incidence of having a coronavirus, as well as its complications, like India and many other places, Pakistan and so. So it seems to be that there are some other measures are going to succeed. One, we're already doing it. Containment, lockdown, and of course, personal hygiene. Second, will be with due time, people developing the subclinical infection and the public and herd immunity. Third, the summer, because this we're talking about the short term. Third is the summertime, the activity and virulency of this virus will go down, and all will be positive. I can assure you that yes, it is a big battle at present, but we are, there are a lot of scientists, a lot of smart people on this earth, and we'll find the cure for it. And yes, we all will help it till we get there. We all need to be healthy. Everybody has to take their precaution and gradually come back to business. And that is where a lot of controversy ongoing at present, whether it's India, which has also opened up in a limited fashion, or in United States, where a few states, particularly Atlanta and others, they have opened. And of course, New York will open hopefully in May 15th. But we all have to practice our personal hygiene and of course those social distancing till we get the cure for this. And cure is around the corner, although that corner could be few months.
That's right. Now, when you talk about subclinical infections, can somebody be a carrier? We talked about herd mentality. So somebody develops a subclinical infection, obviously it's less virulent, but can that person again be a carrier and make the other party, worse?
That's a very good point. So basically, once you are carrying the virus, it turns out to be that you put a virus in somebody's body and don't show infection, after 14 days, that virus is gone. So therefore, yes, you may develop subclinical infection, but after 2 weeks, that person is not contagious. So they develop immunity, the antibody. So that basically, I meant that even more indolent form of subclinical infection, but then other people gradually, same. That the studies have shown now that based on the geographic area, you test the people. You could have 1 to 10% people already been infected and got the antibody. So therefore, that number, once you get to 60, 70%, that's the number we are looking for, that by the no vaccine, by contracting the virus, by manifesting clinical disease, or by subclinical way, let be infected. I mean, I myself, along with all of us got tested. We are hoping that we have antibody and we are infected subclinically, because we never had any symptoms. But turns out it didn't happen yet. But of course, it's a matter that more and more, even a small exposure, will not cause symptoms, but will develop the antibodies.
Will that impact negatively the elderly and the vulnerable, pre-existing condition people?
I mean, clearly that what we have learned, that few group of patients or people are really susceptible, and they show high chances of contracting the virus, but more important, complications of the virus. Most important being people who have heart disease, of course, high blood pressure, diabetes, those who have lung problem, lung disease, and what really came up also, obesity and male preponderance, somehow for various reasons, but obesity. So classical bad milieu. And I can tell you that in last 2 months, I have lost at least 15 of my patients. And all of them had one characteristic. They were old age, more than 65, had a heart problem, and obese and diabetic. So that is a very killer combination, which will have bad manifestation as well as the bad outcome of the disease.
You also mentioned some very good news. Summertime, the virus is the temperature rises, the virus doesn't live long. What happens in the winter time? We don't get another onslaught of this?
Well, I would say that I'll ask my other colleagues to answer that. I hope by that time we will develop the subclinical immunity or herd immunity. I'm counting on that.
Dr. Gidwani, your final thoughts on this?
So that, you asked a very important question, and strategically the hospitals are planning for a couple of things. One is, as the states open around us, we are watching an experiment unfold, and we'll see what happens if they have a second wave. We've already seen a second wave in Singapore, and Singapore is back again in lockdown, and it's a little scary because in Singapore right now it's 90 degrees, what we expect to be in 2 or 3 months. So there are a few scary things emerging. One is that it will bounce back depending on the level of community transmission. So that's one potential surge. And the second surge that we are strategically planning for is again in the fall and winter. So I am not sure that we've seen the last of this, and that story is still to be told.
Yeah, that's true. And I think when everything fails, it's the higher power that we look to, because many times when science ends, that's where spirituality starts. So I think that's where we're going towards. Many things we don't know, unanswered, but and the healthcare professionals like you are working hard to find treatments as we go along. But again, it's a higher state of consciousness that dictates everything, our fate and everything. So I want to thank you all. Dr. Samin Sharma, Professor of Medicine at Icahn School of Medicine, Senior Vice President of Operations, and Senior Vice President of Operations and Quality, Mount Sinai Heart, and Dr. Annapoorna Kini, who is the Professor of Medicine at Icahn School of Medicine, and she is the Director of Cardiac Catheterization Laboratory at Mount Sinai. Dr. Umesh Gidwani, Associate Professor of Critical Care at Icahn School of Medicine and Director of Cardiac ICU at Mount Sinai. Thank you all for sharing your valuable insights, and hope we end on a positive note that this invisible enemy is out of our way, hopefully very soon. Thank you all, and I'm Dr. Renee Mehrra. Thank you.
Thank you very much.
Thank you.